This is the highest number of recoveries to have been announced since the country began recording recoveries from COVID-19 infections. Prior to the announcement, Information Minister Kojo Oppong Nkrumah took to Twitter to prepare the minds of Ghanaians for what he believed was an indication of progress in Ghana's fight against the virus. It is unclear how many of the 786 new recoveries are within the enhanced contact tracing and the mandatory quarantine categories. This is key because all recoveries up until 13th May had come from the routine surveillance. Though a section of Ghanaians have welcomed the news on social media, the question still remains why the Ghana Health Service has lumped up the recoveries rather than categorizing them.
I think another thing that would be helpful with respect to recoveries and the data that's been put out is if we could get it disaggregated. Because up until 2 days ago, we were getting recoveries according to different categories. And as at, I believe, May 12th, all the recoveries we had recorded basically came from just routine surveillance. So what we want to know now is basically how many of those people, of those recoveries are actually coming from routine surveillance. The reason why that actually matters is because all of the cases in routine surveillance are actually symptomatic.
He however questioned whether government is maintaining the 2 times criteria of testing patients to confirm recoveries.
What we should be making sure of, however, is validating that those recoveries are, based on the standard of what we've been doing so far, the 2 tests. I understand the rationale for wanting, maybe saying that you want to do 1 test to verify recovery, but just for the sake of making sure that people are actually recovered, that we have double assurance that people returning to the population is not a risk to the general population, even if they have recovered from their symptoms. I think it's important we make sure that that's what's going on. I don't think there's any reason to doubt that's happening, but it makes sense to verify that and see how that's going.
Out of Ghana's total cases, 1,671 are from routine surveillance and 3,852 are coming from the enhanced contact tracing category. With a positivity rate of 3.71 for the routine surveillance, Nana Akufo-Addo believes it is essential for Ghana to institute a mass testing strategy aimed at identifying cases that our current testing protocols might be missing.
The risk of community spread, like I said, is pretty significant and pretty clear. And this is why I believe a lot of epidemiologists, a lot of lab technicians, a lot of public health folks are beginning to advise that we really ought to look at expanding our testing beyond just routine surveillance and the enhanced contact tracing. The enhanced contact tracing, yes, it gives us a view of people who are at higher risk to be infected, but that's based on what we know, not on the full picture of the reality on the ground.
One good feature of Ghana's cases is a low death rate according to the Ghana Health Service, but with data suggesting that 3 people within the age bracket of 8 and 33 and without comorbidities have died from the virus, many have raised concerns over the risk of young people. For Nana Akufo-Addo, it is necessary for Ghanaians to be mindful of the danger of the virus.
Our reading of the situation around deaths is one of the areas where I think as a country we all ought to be quite cautious. We should look at that data seriously and see the lessons that it's telling us. It's quite clear that the notion that we have a younger population and that would by itself inure us from having, severe or critical cases is not necessarily true, because we're seeing that 3 out of the 28 deaths were actually people under the age of 40, and none of them had any pre-existing conditions. So the risk is real, even to young, healthy people.
Of the 28 deaths, 25 of them had underlying health conditions. Key amongst them are hypertension, diabetes, and chronic liver diseases. With these being common diseases among Ghanaians, Nana Akufo-Addo believes it is necessary for a targeted education towards such persons to understand why they are among the vulnerable in society.